Hi everybody, welcome to another live today. We've done two today. I've done one earlier on this afternoon. I was even later for that one with Odette talking dermatology, and now I'm with Dr. Francesca, and we will be talking all things psychology, and hopefully people will join us, but we are right, I guess, at bedtime hour as well, so depending on the age of the child. Mine seem to be going to bed at about 10 o'clock at the moment because we are too busy working and it's light outside, so they're out playing. How are you doing, Francesca?
Yeah, I'm all right.
You've already just got in from clinic, haven't you? So yeah, it's all.
No, I just did that half an hour ago. So yeah, I'm good. I'm liking the lighter evenings, but I think it makes, and I like having a longer day, but then it does make your day even longer work-wise, doesn't it?
Yeah, definitely. At the moment, trying to get everything ready for the course next week. We're doing like till 12, 1 in the morning, and then like, I need to go to bed. So for people who don't know you, I mean, I've talked about you a lot, but tell us about who you are, what your background is, and then, what your interest in allergies and psychology is.
Yeah. So hi everybody that's joining. My name's Francesca. I'm a clinical psychologist. So my background's like pretty varied. You have to kind of take quite a long route, well, like medicine, to become a clinical psychologist. So at the moment, I work primarily in paediatrics, so with children and with families in kind of more of a health setting. But I've worked my way through adults and CAMS, which is child mental health, and I currently work at Great Ormond Street Hospital, and I for part of the week, and I also work at Leeds University for the other half of the week. So kind of like split massively across the country. I live in New York. I grew up in the northeast, so I moved back here about 18 months ago. So I'm loving like my dual life, zipping down to the city once a week and then coming back.
Back and being a country girl.
Yeah, exactly. It's just the trains at the moment causing me a little bit of I'm trying to stay positive. Yes, what else about me? So yeah, I previously worked at the Evelina Allergy Service. I ran the psychology department within that team there, and that was where I kind of became interested in allergies and passionate about allergies. It made me kind of really aware of how little psychology support there is for allergy compared to other health conditions. And because there isn't that many, the evidence is kind of emerging. There was kind of lots of kind of setting up and kind of figuring out what people needed, setting up the things that really going to be helpful for people. So that's where my interest arose, and I've kind of just stayed really connected with it, even though I've kind of moved hospitals now and I'm not in allergies specifically. I'm still really kind of linked in to it.
So. How many centres across the UK do you know have like psychologists attached to their allergy teams? I know Southampton do.
Yeah, Southampton do, the Evelina do, and they're like embedded psychology services within like allergy clinics, but I'm not actually aware of any others. Like I know there is, so like St Mary's in London has a little bit of psychology support, and I know other hospitals kind of have access to general paediatric psychology, who might have somebody that will be available to the allergy service. But I think it's usually a day, half a day, maybe 2 days, and if you kind of work that out as how many people you can see, it's not a lot, is it?
So yeah, and I think one of the worst things, I think, because obviously it's a GP, is for adults it's relatively straightforward, because I can say, right, you've got access to free, like in our area it's called Steps to Wellbeing. It varies what it's called throughout the area, and they can self-refer themselves. They have a phone call, discuss their difficulties, and they can plan, might you need counselling or CBT, cognitive behavioural therapy, and it's available. And there is a bit of a wait, but like 3 or 4 months. It's not horrendous if you're kind of low level. But in children, we don't have access to those services. So we'd have to refer you to CAMS, which is Child and Adult Mental Health Services. And usually it gets bounced back to us as GPs saying they're not bad enough. I mean, literally, we have children with huge anger issues, very difficult behaviour, parents just not coping. And you're pretty much like, do they have to kill themselves to get therapy? There's nothing. And so even on a general spectrum of helping children, there's nothing, let alone with the niche of allergy. And it just seems even worse than general allergy when it comes to psychology.
I know, it is. Yeah, I try not to think about it too much because it is quite depressing at the moment in terms of like what services available. I mean, yeah, I think that is the feeling around CAMHS, and I've worked in CAMHS. You know, they do a phenomenal job, but demand upon services is just overwhelming at the moment, and I think like exponentially increased since COVID as well. You know, just in terms of anxiety, school refusal, like neurodevelopmental difficulties, it just in across all areas. And I just think that it's just having a huge knock-on effect of their threshold now is, you know, it's literally just that. It's like, how severe are you?
Yeah, and even privately accessing. Well, we know your waiting lists are you're close to new patients at the moment, aren't you? You've got a waiting list. We took our littlest, my little stepson. We were really lucky. We saw an experienced CAMHS nurse who worked privately, and she was wonderful. But I think she's full, so we've been trying to access for our other. I'm on live, sorry, darling, and my big boy. And there's just very limited and also you don't know who to trust, because we were talking just before we came live that when I got divorced, we had therapy for the children, and then when we were a combined family, looking at how we might help. And so we've tried several, and some of them were shocking and others were wonderful, but it's really hard to know who to go to. Have you got any tips of who someone should look for if they're looking for a therapist?
Yes, but I guess just to say it is really hard. And, you know, even as a, clinical psychologist, I think I even look at it and think how hard it is to navigate, because there's just so many different people with so many different terms. And, I guess my top tips are, the term psychologist isn't a protected term. So anybody can call themselves a psychologist, that they might just have a degree or, done a little bit of training and they can call themselves a psychologist. So always check credentials. It's clinical psychologist that is protected term. Okay. And so to be a clinical psychologist, you would be on the HCPC register, and they might also be registered with the BPS as well. So kind of check that they're registered with a kind of authority. But like I said, because psychologist isn't protected, it technically means that people can operate under that unregulated, because they don't have to be accountable to anybody.
I didn't know that.
Yeah, so that's and then there's all these other terms. So like people can call themselves a therapist. There's then CBT therapist, psychological practitioners. So there's kind of lots of different names, and it's not to say don't be mistrusting of all of them, because there's many terms that can be used, but I just always check credentials. So CBT therapists, they would have to also be registered by their different registration, the BABCP, I think it is. So I just check somebody's background, and I guess it's then different types of therapists do different types of things. So as a clinical psychologist, we have to train for 3 years on top of kind of any undergraduate degree. So it's a 3-year doctorate, and it's really rigorous training where you kind of rotate around for 3 different years. You're at university, you're on placement, you have to write a thesis, you have to be trained in research. It's really rigorous and you're trained across all therapeutic modalities. Whereas, somebody might train in a particular type of therapy. So they might be let's say they might do some compassion focused therapy, or they might do some EMDR, and they might have done a qualification in that particular therapy, which is fine, but they might not have that kind of breadth of experience. So yeah, it kind of depends on what you're looking for. Just check.
Yeah. Always. Wow. Okay. So check what qualifications they've got, and then have a quick Google at who should they be registered with, and having a look that way. Good tips. Even as a GP, I didn't, you don't know this stuff. Yeah. So we've had some questions coming in. Lots of very similar, lots of worries, lots of people reaching out to me and saying that they particularly are interested in your module on the help course, that, allergy is a big thing, either just generally for the parent or sometimes with the child as well. So I've had a family who I think we discussed before, who have a teenager who their allergy cert, she's really struggling with eating out and just can't.
Yeah.
And their allergy cert, mum's been trying to encourage, and their allergy service told mum she was doing the wrong thing by encouraging and kind of back off. And obviously we don't know the whole story, but I had sort of said that I wouldn't strictly agree with that, that avoidance isn't going to help anybody. So I guess tips around that. And also she has been looking at a therapist, and the therapist has said that they would like to see the teenager alone, and sort of pros and cons around that, because mum was a bit anxious about, is that the right thing or not? She's a teacher by background, so
fine. Well, I'll start with that bit, the kind of pros and cons of kind of being seen alone. So I guess I would, in my practice, if they were a teenager, I would probably expect to see the teenager by themselves. It's not to say that I wouldn't involve the family. It's not to say that we wouldn't kind of have an agreement or a kind of negotiation about things that might be helpful to share. It might, there might be certain things that I think would be really helpful to bring the family in on, especially kind of regarding family issues or ways that family would help. But I think, teenage adolescents, they really are coming to a place of where their own independence and kind of that slight separation off from their parents in terms of certain aspects of their identity. And I think it's really important that we respect that, and kind of they have a space outside of parents to chat about stuff. And it wouldn't just be allergy stuff that potentially would come up in a session with a teenager. It's kind of all that other stuff that's going on that might be contributing to how they're feeling. Just parents don't really need to know some of that stuff, and it actually might create a better space if they're not there. So yeah, I would think that it's completely okay to see them, for parents not to be involved in all of the session, but certainly where possible, trying to have it as collaborative and kind of setting up a bit of an agreement about what would be shared, what wouldn't.
Yeah.
Obviously in things like risk, I always have an agreement with my young people that if anything comes up that makes me worried about them or another person, that I would 100% be sharing that. But that the other stuff I try and negotiate with the young person as to what we share. And then the first part of that question about avoiding eating out altogether, I would agree that that would not be the advice that I would be giving. We know that for anxiety, avoidance is essentially a behaviour that we're doing in response to try and control the anxiety. I'm feeling really anxious. If I avoid that, anxiety will go away.
Yeah. And
it kind of works. You're like, oh, right, okay, I'm not as anxious anymore. I've kind of controlled that situation. But we know as soon as that situation comes up again, or there's an opportunity to eat out again, or friends are eating out again, or that anxiety just comes back. And then we just have to avoid it I'll just avoid it. And we also know that you start by avoiding one thing, and that, where does that then stop? We start avoiding, maybe going round to people's houses, or we'll start avoiding transport. And I've seen that expand out. So we don't want to get into a cycle where we are using avoidance as it's going to perpetuate the anxiety. So instead, we need to be finding ways of, what I'd call exposure, but kind of gentle exposure, kind of putting yourself in some of those situations. And obviously, we do need to do that in a safe way. We do need to kind of take into account kind of some of the practical things that are going to make that possible. But there are definitely ways that we can eat out. There are certain restaurants that we know are safer. I've had people, because we've also got to think about the social experience of eating out and how it brings you together, and how it brings you together with family and friends. And, we also don't want to kind of lose that experience. I've had children that I've worked with, or teenagers that I've worked with, that they might even, we might even take them out or encourage them to go out, but not eat initially. Or then they might go out and they might just have a drink, or then they might go out and kind of suss out the menu and kind of work out what they do feel safe enough with. And then they might just have a little bit of that. And we kind of work up to kind of build their confidence a little bit that you can eat out and it can be really safe.
Yeah.
Well, as safe as it can be.
Yeah, it's relatively safe. Same as though, well, it's not quite the same, but same as, you can't avoid everything. And I completely agree with you that if you avoid one thing, I think you just expand it. So I get a lot of people who come to me generally as a GP with health anxiety, and just want one particular test because they'll feel better when they know it's not this. And so I have had a patient contact me this week. She just woke up one morning thinking she was allergic to everything. So she wants a test to know it's definitely not allergic to bees. And I was like, I can do that. But my worry for you will be tomorrow, you'll be anxious that you're allergic to this, or that it will develop into now you're worried about cancer, or now you're worried about heart disease. And in primary care, I see that happen all the time, that you will think you're placating them and helping, and you're really not.
Yeah.
So I said, really, I can, but your bigger picture would be that you should go and get some help with this.
Exactly. And I see that as with reassurance as well. A lot, I'm sure you get this as well. Lots of people want reassurance. Can we just get reassurance that it's not that? And, often we think we're being really helpful by giving reassurance, but that's also in lots of situations, a bit of what I'd call a safety behavior. I'm feeling anxious. Give me the reassurance. Okay, I've got the reassurance. I feel okay. But then it means that next time they need that reassurance. And, so I often think with kind of families or partners or people that might be giving this excessive amount of reassurance, how it might be actually unhelpful. Even though it feels like really intuitive to do it, it could be unhelpful. And what can we be saying instead that doesn't, dismiss or invalidate how a person might be feeling, but how can we sit with it? Actually, sometimes we do have to sit with a level of uncertainty, and sometimes being alongside a person in that without this excessive reassurance is more helpful.
Yeah, it's really interesting, isn't it? And I think, we do all do that as parents, and we sometimes, we often make behaviors that are unhelpful, that you spend a long time unpicking because you're trying to be good parents, supportive, give that emotional reassurance. But sometimes when you've developed these silly patterns of things, it takes a long time to unpick them.
And it's, it's not saying that if you do that, it's, it's terrible. And I think, I'm guilty, even as a psychologist, of giving reassurance. So, it's not saying it's a problem, but it's just thinking about, I guess it's just being more curious as to why am I doing that? How is this helpful, or is actually not helpful? And especially if we're talking about like really severe anxiety, sometimes, we do have to pull away some of those things which might be, we see as being like solutions, are actually part of the problem. So that's sometimes something we might think.
We work with a clinical psychologist, but we did family therapy, and you thought you were doing it for the children, but turns out they were like analysing you and looking at like your style of parenting and why did you do that. And it was fascinating because, you sort of unpick, well, why did they behave like that? And how did we get to this position? And so our psychologist was called Dr. Claire. So we often, my husband and I, like, that's not how Dr. Claire would have said to done it. But sometimes we're like, but we acknowledge that was how we dealt with it today. We go back to the strategies on another day because we're all human too. And sometimes, our own anxieties become too much, or stress levels, and we can't do everything perfectly. But being aware is really useful.
It's the awareness that's key. I think we can do stuff and we're going to get it wrong. I think, there's like so much literature around this kind of good enough parenting. And actually sometimes we, have to fail as parents in order to be good enough parents. But where was I going with that? But yeah, so it's not about like not doing it, but it's that awareness afterwards and having that kind of curiosity of like, oh, actually, what went on there when I did that? How did they respond? Just kind of being able to reflect on that style and whether it was helpful or not, so that next time you might want to do something a little bit different.
Yeah, I think therapy is like, especially like the psychology bit for me, I think it's like useful for everybody. I really do. I think it's so helpful. Like it's really helped me with like my teenagers as well, of going, this was, these behaviors are not helpful if I do this. Like think about it from their perspective, try and dig deep and remember what it was like. And it just, now I'm like, let that one go. It's not important to just move on and just be there. And we do a lot of car journeys, so side by side. That's really helpful for the disclosure with teenagers and talking about your worries and things. Okay, so I'm going to go the other end of the spectrum. So a 7-month-old with egg and dairy allergies entering nursery, and he's often grabbing food, because he's only tiny at 7 months. And so since he's so young, I'm struggling with anxiety, thinking about how he's going to cope in a setting with other children eating. She lives in Switzerland, where people are not very well educated about food allergies. When and how should someone start allergy related talks with their little one? So I guess she's trying to think about at what point could she do some transfer of trying to keep themselves safe.
Well, I guess there's lots of different parts to that as well, isn't there? Okay, so I guess that, yeah, so the first bit about kind of conversations, when's right to start. Like, I try to not get families fixated on, right, they've hit this age, have the conversation.
Yeah.
Literally, it's, you're obviously not talking to your, directly with your baby, but it starts with what you're talking about at home, just how you're having conversations, how allergies are spoken about at home, the language that's used, the kind of association with it, like all of that that's happening from, pretty much the get-go, it kind of, that sets the scene for how it's spoken about. Then as your child gets older and kind of has more understanding, they might not have the language, but obviously they're picking up things, they're then going to learn from, like, I guess, your behavior and kind of how food is spoken about, or how things are checked in the house, or kind of the anxiety around the table, or how you're setting up meals. So, lots of the kind of what you're doing and how you're behaving in those situations is going to be how your child is learning. Then once your child gets to an age where they might have speech, or might be able to have those conversations, it's then about how you talk about it. And we'll cover more about that in the course in terms of like developmental levels and the types of language you might use at different kind of points in your child's development, because I think you should be talking about it, pretty much from an early age. But I guess it's just that, don't see it as all right, we're going to sit down and have the chat now, but it's an ongoing part, that's kind of like osmosis in the room.
Isn't it? I was just reflecting that, completely off topic, but thinking about, when you were younger and, you sit down to have the birds and the bees conversation. Or like for me, I very vividly, like, I wanted to know how babies were made. Nobody told me, and what were periods and all of that. And I know with my mum now, she's like, have you talked to Florence? She's my eldest, who's 11. And I'm like, no, not really, mum. But for us, especially being a doctor, there's just always been general conversations of like, if it's that time of month, we'd be like, what's mummy doing? You just explain what's going on in terms that were appropriate to them. I was probably quite medical, so I would just say, this is how a baby gets born. And so for us, those conversations have very naturally just always been part of a, just come up as it arises in the household. And so there's been no disclosure about it. It's always been there. And I think it's thinking about it in the same way, that actually you are always every day talking about allergies with your other half, with other parents, with friends. Your little one will be learning, so just be conscious of how you're talking, I guess.
It's exactly that. I think sometimes we put too much pressure on her, like, this is a point, right, we need to kind of, they've hit this age, have a talk. But it's really not. We forget how much children are kind of taking in, even in
my little one, I'm just like, she's 8 now. I'm just like, Genevieve, do you just hear everything? I mean, she is the most socially astute child in the world. Having gone through a divorce at an early age, she was 3. Like, she picks up on tone. She'll know exactly who you're talking about from the obviously talking about exes. She'll know everything. I mean, she's like that one. I'm like, blimey. Okay, so
that question, I felt like there was other parts to it, but I guess they are only little, and I think it is with nursery, with them being so little, I think that of course there's going to be anxiety there, and it's kind of, and again, we'll talk about this in the course, it's kind of like, what's that safe enough position? What have you got control over? There's so much there you don't. How can we focus on the bits that you have? I think kind of the conversations, even if the nursery aren't that clued up, how can you be kind of facilitating those conversations? How, possibly could you be getting training in? So it's going to be thinking about the different bits that you have got control over in that situation.
Yeah, how open is your nursery to hearing a little bit more information? Is it going to be you that teaches them? I know that that particular mummy is on the course, the whole course, so that's great. Can she share some of the resources? Anaphylaxis UK's in school and nursery program is online, whether they would allow them to access that if they could talk English, because English. So you're going to have to do a little bit of work yourself, unfortunately, to educate them and make sure then that you're happy that nursery's got the skill. But the same in the UK, there are nurseries that are amazing and there are nurseries that are shocking. And I've been involved in writing a few Ofsted complaints with people for like advocating for them. So that was in the UK. Okay, so 5-year-old, similar. So how is the best way to support him to make sure he doesn't end up with anxieties, and in brackets, like I have? And that's probably the clue, isn't it?
Yeah. So yeah, I guess it's just really similar. And I think it is hard if, well, I've worked with so many parents that have got anxiety. And, I think that fear of like when I give my child anxiety kind of has been a bit of a theme that's often come up. And I guess what I'd say to that is, again, we kind of have to have some compassion that you're doing the best at what you can with the what you've got. So starting with compassion to yourself will actually kind of really filter through. If you're treating yourself with that compassion, again, it kind of filters through to your child. I think trying to be as calm as possible, being a little bit aware of what your child is picking up on. And I'd really encourage parents that are anxious to kind of get that support for themselves or have those outlets. Perhaps the child doesn't have to see as much of that, but equally the way that children witness their parents like manage their own anxiety is really important, because we all have anxiety. Often people say, I don't get rid of my anxiety. I'm like, well, actually, some anxiety is good. We're absolutely not going to get rid of the anxiety, but we need to know, when it's helpful and when it's not helpful. And when we do get anxious, how we manage that. And actually, your child watching you and kind of you like name your anxiety and how you manage it, and them having a really good model of how you've managed your anxiety is going to be as powerful. It's going to be so powerful for them because they're going to learn from that. So yeah, I think kind of having good strategies yourself, which again we'll cover in the course, will be kind of really helpful for that.
Yeah. And she's again signed up particularly for the course and for your module. But she said she's in York, so there you go. And doesn't think there's much support in her area. She's been asking for help about allergy related anxiety, I guess, for herself.
Yeah.
She said any places you could sort of signpost her to get some help for herself. The York was a coincidental, actually.
Wow, well, isn't that a coincidence? I mean, I'll be honest, I don't know loads about the service. My clinical work is based in London, but I'd love to work up here, and there isn't as many services. I think that, well, and again, I don't know what has access to. I think that Leeds Children's Hospital, I think they have a little bit of support from paediatric psychology, so it might be worth kind of, I guess, just not necessarily taking that first no as an answer. Well, what is there, pushing a little bit more. It might have to be thinking a little bit outside the box and doing things like the course, trying to link in with other parents, I guess, support groups.
And ask your GP if you're thinking about for yourself. Well, what services? Okay, they may not be allergy trained therapists, but that there will be a basis of understanding anxiety and avoidance, and understanding, I'm sure, that why your anxiety is developed. I think that's natural for anybody to understand that. So I would.
And there's the IAPT, Improving Access to Psychological Therapies, which I think has rebranded. I work more now in the health setting rather than mental health. The whole point of that is that it's kind of quickish access to kind of short-term psychological support. So that could be, definitely something that I'd encourage to access. But yeah, I guess just to say, it is hard. I don't like to sit here and be like, well, we're limited on support, but that's why I'm doing this course. That's why I was so passionate about linking in with you. It's trying to kind of, give something where there is limited resource.
I'll do 2 more questions because they're not quick answers, because it's
not too much.
No, but it's not a quick answer, is it? Because it's not they're not easy solutions. That's why we're trying to build strategies for people.
Yeah.
I guess similar sort of vein. So one person said, how do they deal with anxiety knowing that the school has kind of has accidentally given their child the food that they were allergic to? And the other one is slightly different. I'll do the other one separately. I mean, we had Ethan was given ice cream, and it is frustrating because he had a dairy allergy, because I was like, you couldn't get more dairy. But I was actually more frustrated with how they handled it in his case, because they rung me and said, should we give the EpiPen? And I was like, well, is he having anaphylaxis? And they didn't know. And then they didn't actually give him antihistamine, so he was just swollen all afternoon. And I suppose I did lose some relative confidence in them. And probably in hindsight, I don't think I advocated enough for him to go in and say, I'd like to know how you're going to address this to make sure it doesn't happen again.
Yeah. So what I was going to say as you were saying that, but you've kind of just answered it, is I always go along the line of like, try and make it a shared problem. I think we often, parents that I've worked with often, it's theirs, like, I've got to fix this, what can I do? Like, make it shared, I own this, child has this is what we need. What are you going to do? How are you going to support? What's going to be your policy? And try and make it really collaborative. Try and, we can do this, what can you do? But it's like that really shared collaborative narrative. I think it does work best when you've kind of, got that real open dialogue. That then builds the trust. And if you're getting that feedback from school, even, when there isn't reactions, but like around near misses, or this trip is coming up, or this, just where you start to build that trust. I mean, obviously it's completely school dependent and they're not all like that, but I think trying to get that collaboration from an early age or from an early point in starting school is going to help build that trust. But yeah, it's hard, and again, it's focusing on the bits that you can control.
Yeah, I think go in as much as you can a bit open-minded, rather than saying you've done this, because obviously we can understand why people would be cross. And I hear that a lot. But I know when people come to me cross as a GP, and often not because of something I've done, but because of a system or whatever, it's really hard, because I have to work really hard to get them to calm down so that we can even focus and have a constructive conversation. So if it's at all possible to put your crossness at home and then go in as calm as you can be to look for a solution, people will also, I think, be more open to come to that conversation. Because we're all humans and we don't want to be feeling like we've been blamed, because they probably feel bad anyway.
And again, in the course, I'm going to talk about anxiety and the kind of threat response. And we've also got, parents feel that kind of that constant threat and danger, but it doesn't mean that that's not elsewhere in the system as well. And teachers are often feeling kind of under threat as well, or like you said, when they come in and they feel kind of attacked, that we've got to be aware of how this anxiety is being passed around the system. Or I'm feeling anxious, give this to you, give it back, and that's also an unhelpful process to happen. So yeah, exactly, where possible, we kind of need to lower the threat, put the anxiety down, so that we can actually start thinking about the solutions and the collaboration and the kind of way forward. So
yeah, that's so true. I think, when people ring, like if you ever hear something's gone wrong in primary care, like if I hear it might be even something simple like the wrong prescription went to pharmacy, I immediately have a massive stress response, because I'm well aware, and those situations make me well aware of how responsible I am for someone's life. And teachers will know that they were responsible for that child's life, and we've all heard of terrible stories as well. But yeah, you're completely right. Like it's not helpful though. It's trying to learn to let that go, so something constructive could come from what's happened. But yeah,
if we think about what would happen if a school does feel bad, or they do feel attacked, I'm not saying every person, but what's your natural response in that situation? Is to be defensive. And then you're not actually going to get that conversation that you need to stop that happening again. So I think sometimes even as it's really hard in those situations, but sometimes when I map it all out and we draw it all out, we actually realize that if we can approach this in a slightly different way, that actually we might get a better solution out of it.
Yeah, which your child needs, because they've got to go to school. Well, they don't have to, but that'll homeschooling, and that's not for me. And so somebody else said, how can she get over the trauma of her child's recent anaphylaxis episode? Need EpiPen and ambulance needed. She felt that her confidence had been building, and now it's gone again.
Yeah, well, and is that the parent over the trauma, or I'm
assuming that's the parent? Yeah,
gosh, it's just so hard. I think after an anaphylaxis or a kind of serious reaction, I think when I've kind of spoken with parents, it's all about the narrative of that trauma. And I think what we need to try and move towards is actually what went right. And the medicine worked, the treatment was there. And, you know, it's not to dismiss what's happened, but it's really important to build that alternative narrative alongside, because otherwise we just get, re-traumatized by what's happening. And, you know, and an analogy that I often use kind of when talking about trauma is kind of how our brain stores memories. So I like to, I don't know if anybody's ever heard this analogy, but kind of when all the time we're making memories, and it's kind of like we have you know, our brain's like a giant filing system. So if you imagine it as like lots of different filing cabinets, every day stuff's happening. We have like a storage system. Oh yeah, that happened. That's a family thing. That goes in the family cabinet, or that goes in the school cabinet, or, you know, and we're building up this, and that's essentially our memory. It's all these different filing cabinets. But when there's a trauma, or when something's happened under kind of extreme anxiety, that anxiety becomes a blocker for storing that piece of paper or that memory in the proper bit of the filing cabinets. It's kind of like it's all happened really quickly. We're not processing everything. It's kind of like that piece of paper has been shoved on top of the cabinet and it's just lying there, which means that every time we go to put a memory in, it flies back out at us. And, you know, there's bits that are often missing, because we know when we're under threat or stress, we haven't actually remembered everything about that. And every time it's popping back at you, it's your brain desperately trying to put that back into the cabinet. So sometimes, and it doesn't always have to be immediately after, but sometimes there is a bit of a kind of going through and rewriting that narrative about like what happened and this happened. Okay, yeah. And it's trying to take some of the distress away from it, trying to just kind of the actual facts of what happened enough to store it properly, which, you know, it's not dismissing that, it's not trying to erase that memory. It's trying to just put it that was a memory, that's something that happened, but we're now moved on. Sense.
Yeah, I think that's really good. It's really interesting. And I think, like say, focusing on the positive bits of it. I'm thinking about particularly food challenges, where you'll come across that as well. Yeah. And I was speaking to a consultant this week who's an adult allergist up north, and her son has allergies, and they went on holiday. This is probably not going to help people's anxiety, but her son's friend died from his allergy, and I said to her, "That's obviously terrible. Has it affected how you practice? Did that change how you responded to your son? And has that made you different as an allergist?" And she said, "Well, not really." She said, "I'm probably like an unusual character, although I identified with her very much." But she said, "But what I did was I did like structure it. You know, I thought about statistically, how common are these things? What did he learn from it? How is he dealing with it?" And she sort of said, "I put it into boxes that was scientific, and that helped me move through it, and it hasn't changed me as a person." And you know, we all have our different ways, but we need to find those ways sometimes to help you manage them.
Yeah. And I always think that, you know, like I literally conceptualize it with people as like, that's the past, that's gone. Like right now, this is the present, and then anything else that you're worrying about is a future that's not there. So we always need to be in the present. We always need to be like, okay, well, like now I'm safe. Nothing's happening. We're all okay. That stuff that's happened, but you know, we're not there. If we get pulled back to it, you know, we want to bring ourselves back to the present where it's okay. And if we're worrying about something that hasn't happened or that could happen in the future, you know, what's the point in being there either? Like we need to be a bit more present some of the time. So, you know, lots of the strategies that we might put in for anxiety is about just doing that, bringing yourself back and not being pulled to these worries, which are future things, or memories, which are past things.
I always find it fascinating. I can't wait for your talks, because I'm going to sit and listen to them all, and then learn even more strategies about myself. So reminder, so tell me about what's the module on the help course, because that's the first one that's been released.
Yeah, so I've also written it down to remind us to kind of rein it in with everything that I want to talk about. But today, like on the course, it's kind of like generic modules. So we're going to talk more like about anxiety, about the threat response, you know, about why it's there. I guess just to kind of help normalize and not, you know, because I think it's really easy to sometimes pathologize anxiety, whereas actually we need to think about when it's helpful, when it's not helpful, and unpick a little bit more about some of the behaviors, some of the patterns we might get into, and just be that bit more curious and gentle with ourselves about like what is helpful, what isn't helpful, so that we can try and reduce some of those more unhelpful behaviors and put in more of what's helpful. Going to talk a bit about what I call like safe enough position, because I think often people come and they want this certainty and this 100% confidence, which I can't give, which you can't give. which is actually nothing in life is really that. So trying to help people move to kind of this good enough, safe enough position, and it'll be different for everybody, but just sometimes that kind of giving that permission that there isn't this kind of huge expectation can sometimes be a big relief for people. So I'm going to help people think about that, help people think about kind of the things that are in control versus what they're not in control, a little bit about kind of tips for being a bit more present and managing own anxiety. And we might talk a little bit about like how we can have conversations at home, and the narratives at home being really important. I'm really passionate about that, actually, that the narratives and how we're talking about allergy and how we're talking about kind of how much that allergy defines a child, because it shouldn't, it's part of them, but it shouldn't define them. So how we can bring in those alternative narratives. And then we'll think a little bit about kind of spotting anxiety in your children and ways that you might notice it and label it. So that's going to be the kind of generic.
All in an hour.
All in an hour, I know. We'll try and cover all of that. But then, as you said, we're going to try and then do some kind of more specific targeted modules at some point in the future, very soon, where we can go like a bit more into like particular I guess more particular issues.
So we've got an eating out one, a schools one, and
introducing new foods,
which you sometimes think, well, I'm not weaning, but blimey, that can still be relevant at 30.
And I guess it's not just going to be like introducing foods for babies. It'll also be children that might be have took food out because they're fearful or because of that association, so kind of putting stuff back in, kind of talking about that difference between like fear of food versus an allergy, because that comes up a lot. And obviously I work very closely with the allergists, but like to kind of unpick this, like actually this is being avoided, doesn't need to be avoided. So we'll kind of talk a bit more about like dig a bit deeper into that in that bit of the course as well. But then introducing new foods, kind of the playful approaches to kind of putting foods in, setting up positive meal times, things like that.
Yeah, it's really helpful. We needed that in hindsight. We always talk about when Ethan had his food challenge and it went just the wrong way. And now I'm trying to think about the good things. But the good things were the team were amazing. But really, he probably needed some help with like what was going on for him right then. Because even as I said, I was an naughty allergist and hid the food and saw that he actually could eat it. It didn't actually help him. He still went several years of going, has it got nuts in it? I can't eat it if it's got nuts in it. And it took him time and reassurance of just, you can. And I was fairly chilled, I think, but he got there in the end. But it's really, they're going to be amazing. I have had several people reaching out saying, I want all of Francesca's modules. When are they coming out? So I'm like, she's a very busy lady. I'm trying to like pin her down. But
I've kind of like planned that. Well, I know exactly all the stuff I'd want to share, but I think, I guess the other thing to say is if stuff comes up, even though I've planned them, I've not recorded them yet. So I guess that's the beauty of this is, we can try and put in things that are helpful or going to be most helpful for people.
That people are asking for, we'll be responsive and adapt. And the nice thing is obviously when people have the modules and the whole membership then will have access to having the Q&As, so they'll still learn because not everybody appreciates that anxiety is playing a part in their life. Or
I know, and I think this came up at the summit, didn't it, about like, I think when I look back at some of the questions, it was kind of fear, like, well, if I see a psychologist, will I be referred to, I think one of them was to like social services or kind of this side. I think there is still, unfortunately, this real stigma about psychology. But part of this as well is for me to like really put on the map, like actually this, psychology is as part of the holistic package as all of the other stuff. And no, it doesn't mean that you're crazy, and no, it doesn't mean that there's something wrong with you. Actually, like positive, like having positive mental health and having strategy, we all need those. I wouldn't function if I wasn't applying half of the things that I like preach and talk about. I use them on a daily basis. So I don't think that it can not be helpful, even if you don't think that you need it.
Yeah, no. Well, I think it's fascinating. As I said, I really do. I'm like always like, wow, I do that. So I think it's brilliant. Yeah. Thank you for your time. I'm going to end it and we're going to have a quick chat backstage because we're going to just do a bit more preparing. I hope everybody found that useful. I think you can watch it back. Thank you for your time. Really helpful. Thank you.
Bye, everyone.